I'm Dr. Stephen Elliott. As the most recent addition to the physician team here at the Center for Occupational and Environmental Medicine, I'd like to tell you a little bit about myself. I'm a graduate of the Indiana University School of Medicine. I'm conventionally trained and board certified in family medicine. I've been practicing medicine for 27 years and functional medicine for more than 14 years. It was just a few years into my career as a conventional medicine provider, however, that I became increasingly frustrated with the limitations placed on myself and my colleagues as conventional practitioners, moving rapidly from one exam room and one patient to another, to another, to another, seeing 20, 25, 30, sometimes more patients a day, being allotted 10, 12, maybe 15 patient minutes per appointment, writing more and more prescriptions, ordering the same tests over and over again, making referrals to the same types of specialists and subspecialists over and over again, but not ever, or only very rarely, seeing any significant improvement in my patients' chronic medical concerns. And it was out of that frustration that I found myself asking the question, is there another way? Is there a different way of approaching health and practicing medicine? And it was in pursuit of that question that I found myself discovering functional medicine and functional and integrative medicine. So, functional medicine, what is it? Well, it's complex, there's a lot involved, but the goal of functional medicine is to identify the root cause or root causes, and often there are many, of any particular constellation of symptoms or particular health problem, and then once identified, to try to turn that around as rapidly and as naturally as possible. And sometimes it can take time to do that. Chronic problems typically don't get solved quickly, and that's something you have to wrap your brain around in the functional world. But over the years, I have found myself excited and increasingly impressed by the wide and growing number of areas and health concerns that can be very significantly impacted for the good by taking a functional and integrative approach. Problems like the normal decline of production of important hormones and the use of safe bioidentical hormone replacement for women, and testosterone repletion for men, a more comprehensive approach to thyroid management and assessment, adrenal fatigue, chronic headaches, unrelenting insomnia, chronic fatigue, chronic gastrointestinal problems like years-long constipation or diarrhea or leaky gut or bloating, food sensitivities, chronic skin conditions, random rashes that come and go, toxicities like mold toxicities or heavy metal toxicities or environmental toxicities, neurological and psychological concerns and problems like depression and anxiety and ADHD and neuropathies and brain fog, even a more comprehensive approach to cardiovascular risk assessment than is typically encountered in the conventional world, with its hyper-focus on cholesterol and the overuse, in my mind, of statin medications. And the list goes on. Functional medicine is complex and often slow to turn chronic problems around, but I have found it to be a very rewarding way of practicing medicine. Why? Because I see results. I see chronic problems improving. I see lives changed for the better, with the goal always being more optimal health and a better overall sense of well-being. Thank you.